Good morning, good afternoon, and good evening, wherever in the world you are. I am Dr. 𝐂𝐨𝐬𝐬𝐢𝐨, vascular surgeon of more than 35 years standing. Today, my main field of interest is veins, ulcers, and compression. Now, what is the importance of compression, or what is the basis? Compression is used in the treatment of chronic venous ulcers to obtain wound healing, and also in deep vein thrombosis or post-thrombotic leg to improve the function of the leg. How does the compression improve the leg function? One, it reduces the edema. When the edema decreases, the perfusion pressure increases and the oxygenation improves and the ulcer healing is obtained. It also causes the compression of deep veins, improving the venous returns. This is proved by MR, magnetic resonance imaging techniques, that compression of the deep veins will cause better valvular compliance, the valve function improves, and therefore the edema and the circulation improves. It has absolutely no function on the superficial veins. Before you do any compression therapy, there are a few criteria that you have to meet. First and foremost is look at the ankle brachial index. If you can't feel the pulse, if you can feel the pulse, you can go around with the compression bandaging. If you can't feel it, with the handheld Doppler, please do an ankle brachial index, otherwise known as the ABI. This can be done by any of the staff nurses who is trained in this. Second is look at the skin architecture. If the skin is very delicate, do not use a high compression therapy. Use a lesser compression. We'll come to that much later. Now, what are the compression modes available? The compression modes available, the most common is the stocking. So the stockings comes in various pressures. Class 1, other is 10 to 15 millimeters. Class 2 is 15 to 25 millimeters. Class 3 is 20 to 40. And above 40 is class 4 stockings. So we can use a combination of stockings if you don't have these varieties, depending on the pressure needs. So you can use one stocking on top of the other, and that has to be decided by the vascular surgeon. If you use too much compression, there will be ischemia in the leg, and that is the treatment will be worse than the disease. Today I will mainly deal with the stockings, how they are applied. We'll come to that on a second part. Before that, we will deal with how to do a bandaging of the venous ulcer. This contains a very special layer outside. We open like this. Outside there is a layer where the fluid will not escape. Inside there is a layer, very soft layer. It does not stick to the wound. And inside this there is another layer, a high absorbent layer. You can see this. This will absorb all the fluid. The function of this one is to get attached to the floor bed of the ulcer, so you don't have to scrape or curate the wound. When you just take out this dressing, along with that all the debris will come out. This will absorb the fluid. Now the question asked to me is often is, how long should you keep this? If there is no wetting on the sides and if it is not coming out, you can keep it for usually 7 days. If a wetting happens, then we will have to change it. Now, how does this wetting come? This wetting comes because of the lymphatic leak primarily. Lymphatic overload in these veins will cause the fluid to come out. The lymphatics can handle up to 2.5 times the venous flow. But whenever there is a venous stasis, lymphatic overload will be there, and that is why the infection happens of the lymphatics, and thereby the fluid flowing outside from the leg. Most of the patient will tell this wetting is there, pain is there. Why is there pain? The pain is there because of the free nerve endings being irritated by the fluid, infected fluid. So how we should apply this, I will show it later one by one. We will first speak about how to apply these compression bandages. The first is a layer like this. It's a very soft. It is a cotton type, but it actually does not have cotton. The problem with cotton is sometimes you might get skin irritation. This is a non-irritating thing. So I'll show you later how to apply this. The second layer, once you apply is another soft layer. It's a long stretch bandage on top of it. So I'll show you how to apply that also. So then here comes the third layer. Third layer is another medium stretch bandage. The advantage of this is slowly the edema will come down. So once this bandage is there, what happens is very simple. It will keep the other three layers and the pad in place, so that there is not dislodgement is not there. The integrity of the bandage is maintained. So the first and the most important thing is clean the leg of this demo patient with a sanitizer. And it is alcohol with about 70% plus chlorsalinol. So you have to clean the whole of the leg wherever the bandage is going to get applied, so as to remove all the oily substances in the wound, in the leg, sorry. So once that is there, a single one is enough. Once that is done, be very sure that you don't touch the part where the ulcer is there, is where the pad is going to land on the ulcer. So you keep, once you keep there, it gets stuck. Give me the, no, not that. Take a bandage, apply them. Lift. So you apply like this, 2 or 3 rolls. This is to steady the bandage. Do not use a plaster in this area because the plaster will be allergic. See, when I'm bandaging, how it is moving. It should not move. It should be always in a X style like this. Okay, give me a blade to cut this. So we leave it there. So we have fixed the pad on the ulcer. So now we will go with the soft cotton wool. The soft cotton wool should be always unrolled. Unroll like this. Lift the leg, please. Then go above the ankle carefully. Then come down. Then go up. Then come down and cover. Simple roll is enough. Always keep half like this. Don't have to apply it tight. Make it, even if it flows, that's okay, because the next layer is coming. Now the next step is, this is a 𝐂𝐤𝐬𝐢𝐨 pad. Keep it against the Achilles tendon, because this is a very soft area, and if you apply a bandage too tight, you can damage the Achilles tendon and the heel. So adjust and keep it this way. Just hold this. Okay. The next layer is this stretch. It is during this phase that we will try and maintain this loose things, fix it up so that it doesn't slide. See how I'm crossing, and see how this pad is protecting the heel as well as the Achilles tendon. And this you can go straight away 50, 50, 50, no problem. Never use plasters. It's the skin, because it can be allergenic, even if the company says otherwise. And always this, keep it down. Always these bandages, just hold this, should come. See, this is the medial malleolus. Sorry, not medial malleolus, the tibia, lower end. And come here. Keep your bandage. This is where the nerve, peroneal nerve comes. So don't go up to the level, come to about 2 centimeters below that. So that is why I kept it here. Just hold it. Next layer. Third layer. This one you have to be very careful. When you come to the third layer, you see this green line. The next roll should come on the green line. And always apply a little more pressure around the ankle, because the maximum blood pumping has to come from here, this particular area. So apply it. Once you have covered the ankle well, see that there are no folds. If folds are there, there will be pain for the patient later. And it will be, see, check the green line. So once I have the green line, what I do is follow the green lines. That's all. And every time I apply this 50 on 50, the pressure is increasing. So this much only, don't stretch more. Follow the green line. And when you come to the calf, what you should do is apply a little more pressure, because the diameter is more here. So we have to apply more pressure. Otherwise, sufficient compression will not be there. So once this happens, just hold this like this. Give me the next layer. So now this bandage can slide up and down. So to prevent that and to maintain the integrity of your bandaging, the sticky thing will be there. So that this layer, be very careful. See that it doesn't touch the skin. You can always unroll like this. This layer here, apply 2 times, because you need to compress the foot. Then go for the heel carefully. And go 50, 50, 50 again. see me doing 50-50. Here, don't put too much pressure, but you can have 1 or 2 more rolls because this will keep the calf intact. So however you carefully apply, if you see here, there is a chance that you might touch the skin, but actually it's not touching, but make sure it doesn't touch the skin. So now there is an integrity. It does not move. Whatever you do, the bandage will not move. Here there is a little bit. Deliberately we have kept it that way because this 4-layer should not come on the heel and cause an ulcer. So you can just leave it a little free. But the pressure is always there. It doesn't look good, but this is okay because you don't want the ulcer on the heel. Once there is an ulcer on the heel, it will take months to heal. Now, the next step is make the patient get up. Get up and do 20 times like this. 20 times. If he is able to do this, that means the blood is getting pumped up. Is there any pain?
No.
No. 20 times. You can flex your knees also. Okay, fine, sit down. So make sure that every patient does that. He does not have pain, or you can even make him go and walk for 10 minutes and come back. Because if you have pain, you should immediately remove the bandage and make it less tight. So again, before the patient goes, double check whether this layer is in touch with the skin. This layer can cause skin problems. Then always clean in between after finishing bandage, check in the website, see the fungus. So give me sanitizer. So what you should do is clean like this with sanitizer. Give me a dry gauze and keep a dry gauze in between. Actually, you don't need antifungus but this is just excoriation because he is using a shoe. And you can just push it inside this and push this one inside this. One more. This is okay. So that much. If any other toes is showing crowding, you always do this one. And you can push this inside, push this inside this. So that is okay. Now we'll stop here. So remember, the first layer is the Velsa pad. The second layer is the 𝐂𝐤𝐬𝐬𝐢 or that roll, soft roll. So that should be done. That much needs to be done only, and nothing more if there is edema in the skin. If there is edema in the skin, you have only this. Once the edema comes down, you remove all that. Start from beginning. 1, 2, 3, 4. See that the patient tolerates all the 4 bandages. Now there is, keep that leg down. Give me the other leg. Only edema. Imagine he is having edema. He is having high tension here because of his leg edema, foot problem. He is not getting pumped up. He is having a peroneus longus and brevis tendon issue here. So the anterior compartment is there. So once the anterior compartment is there or a posterior compartment is there, such a, see, first lift it like this. Apply this bandage carefully. Just pull up a little bit. You can leave this loose. Next cockle, specially made by the company for me, because in the interest of cost. Give me a gamji pad. This is about 10 meters long, so it should be enough for about 3 or 4 patients. Again, keep a pad here for safety of the for the safety of the heel and the Achilles tendon. Then roll, unroll as usual. See that the pad is in place. Then you hold this, and you don't have to make it too tight. You can leave the heel free. If you want it to look good, then of course cover the heel also. So you just apply like this. You see me using 50-50. So make sure that this one stays on top and does not touch the skin. Cut. And it's stuck. And if you want, you can roll it a little bit. So make sure that the skin is not touched. This heel, you can leave it open. So this is another 2-layer bandaging technique. Check all. Does not have any problem. He has still, you can take a video here. He has a fungal issue, so sanitizer. Clean it. Cotton wool. Lift. Then what you do is, this is a very short stretch or no stretch bandage. In lymphedema, don't leave the ankle open, it has to be closed. So now we will come to the technique known as the X bandaging. Once you come above, come below. Go up. Come down. When you come down, pull. And of course, if it's a lymphedema, you'll have to bandage up to here. That I'm not doing it now. In the calf, you need 2 or 3 more rolls. So this bandage has to be applied in the morning and removed in the evening. This is a reusable, washable bandage. So you can reuse and wash. But next day morning, it may not be dried. So what I would suggest is use 2 clips. Come with this, but don't use clip. Use a sticker. What happens is, however much you are careful, you see this jumped out when he has done this. If you find this, take it out, do it again. Why is it a problem? You have to always unroll, not this. If the ulcer forms there, the Achilles tendon gets infected, the nurse will be losing her license. The doctor will face a litigation. No other problem. Cross. Now. This will stay on only for 12 hours. After 12 hours, you have to reapply the bandage. And you would have seen, even a perfectly young, healthy man wearing shoes, how he will get fungal infection or escoriation in the web space. So that has to be checked. In this particular field, nothing can be taken lightly. Nobody is perfect. One must be willing to learn, unlearn and relearn and do things properly. I deliberately shot this on a model because there are privacy issues with patients. So we cannot take with the patient unless he has a written consent. And also, if he acquires money, an agreement, lawyer's agreement has to be signed with him. So when you take videos, be very careful. Only good stand. Okay, fine. You see that green dressing thing. So all the sterile things has to come in a small dressing set like this, autoclaved. One person to open and give and handle all the unsterile things, and the other person to handle the sterile things. After each patient, they should all remove the gloves. So the latest thing around in town, and which has been advocated by French and our group especially, and German group, is the new thing known as the WRAPs, WRAPS. So first thing, we'll come to the technical days later. We'll show it first. Let's put this on. This is what she's putting on is actually a very thick piece of cotton stocking. It gives about 5 millimeter pressure of mercury. Now you will ask, what is the role of this? The role of this is to protect the skin from the next layer, and this is usually preferred once the ulcer has healed. To maintain the ulcer healed, to reduce the pressure in the leg, we use this, and it's quite a thick one. Okay. Now next, what you do is put this up his leg. I'll show it later. Put it up. Make this elastic things a little loose, but don't disturb it. Pull it up. It goes up. Pull it up. This measurement is similar to that of a stocking. There are sizes are very small, medium, and large. This particular gentleman has actually medium, but here we are having a medium. Large variety. So now once you have put that, pull this. On the Velcro, pull this up and see. This is the way to do it. It's quite easy to teach the patient. So this will protect, this with shoes will protect the forefoot. When you apply this, bottom layer should not come on the Achilles tendon here. If it comes, it can damage. I normally do not recommend this when there is an ulcer. I recommend this once the ulcer has healed, to make it healed. Two problems with this. Point number one is somebody has to teach the patient how to apply. But if the patient has a tummy like me, to bend down and put it is a little difficult, but it is much simpler to that of the stocking. But if you have a problem in the abdomen or up in the deep veins, valve problem, thrombosis, etc., the result may not be that good. But this is scientifically well proven to give a good result worldwide. There are 2 or 3 companies now in the world manufacturing. One is from Germany, one is from Switzerland, And luckily we have one from India too. Thank you.